Welcome back. Well, we are counting down the days until Ochsner Health's Big Health Event. It's one of many strategies to help improve healthcare access and better health outcomes among African American families in our area and across the state. Now, over the next few days, we'll be talking to local professionals about different topics. And joining us this morning with more on women's health is Terry Edwards, Director of Labor and Delivery Services, and Trey Nelson, Director of Economic Development and Community Initiatives. Good morning to both of you, and thanks so much for joining us.
Morning.
So you guys have a lot coming up in the next couple of days. I know that we have a few topics that we're going to touch on before this big event that's happening in about a week or so. This morning we're talking about women's services, and there's a lot under this umbrella and what is being offered, but kind of talk to me about why it's important to talk about these things when we're talking about health equity as it relates to African American women.
So when a patient comes in who's trying to have her first child, it is very important for her to have already started to build her health, meaning eating right, making sure she's going to the doctor, discussing her plans with her doctor. So a health event like this will kind of start the patient on the front end, getting ready to go through a pregnancy.
And while we are talking about pregnancy, that's one of the big issues here in Louisiana is the maternal mortality rate. We kind of have it really bad here compared to anywhere else in the country. And that's something that I know health officials are working to improve in our state as well. How does this event help with something like that, kind of starting that conversation?
So we're pretty unique here is that we have midwives that we use pretty much in the hospital setting, and they do most of our deliveries here with the backup of the physician. So our patients have a one-on-one relationship, and they build that relationship throughout with the midwives, and of course their OBs as well collaborating. But that helps a lot when it comes to these important health issues that the African American community are facing.
And I just wanted to point out that next week is Midwives Week, and I know that you guys are also going to be doing something with that as well. But while we're still on the topic, how are we trying to improve how early women in African American communities are going to doctors to get those health screenings that we're supposed to have? When we talk about fibroids, for example, that's something that most women don't find out that they have until a little later, when maybe they could have figured that out in an earlier health screening.
So that's why opportunities like the Big Health Event are so important. So if we can get into the community and get the word out, that is what's going to change the outcomes overall.
Yeah, and I'll look too with the whole concept around the Big Health Event is healthcare innovation, right? So looking at how can we use new resources in the market like the Southern Ochsner Jackmobile, where we're going out and doing screenings directly in local communities, and how can we look at bringing groups like Pfizer and Johnson & Johnson in for the Big Health Event to expand some of those resources. So looking at how do we innovate the space around screenings across the board.
And that Big Health Event is happening on October 7th. For anyone who is looking to attend that event, what can you expect at this event? I know that it is for the entire family, and there is literally something there for everyone.
Yeah, look, everybody come out. Big Health Event is going to be, as it is in the name, big. We have pretty much all things from STEM NOLA is going to be coming up, and they're going to have 60 individual stations, including a drone station for the kids. We'll have cooking demonstrations going on throughout the day. We'll have panels talking about a whole plethora of different healthcare related subjects, including screenings, health and wellness, gut health, all different types of things. And then we'll have a multitude of screening opportunities there as well. So we will truly have something for everybody of all age groups and all backgrounds at the Big Health Event, and we encourage everybody to come on out.
And then right before we wrap this up, for anyone who is looking to attend that event, is it free, and where can you go to register? Do you need to register, or can you just show up and accept these services?
Yes, so the Big Health Event is a free event. Once again, free. The link is on the Urban League website. We're additionally going to be doing some marketing, kind of pushing it out there for the community. In the event that you aren't able to sign up ahead of time, and everyone's pretty busy this time of year, you can register at the event, and it'll be fantastic. So doors open at 10 a.m. It goes on through 4 p.m. We're excited to have everybody.
All right, Trey and Terry, thank you so much for joining us this morning. As mentioned, we are not done talking about this topic. We're going to have a rep on the morning show tomorrow to talk about this as well. Thank y'all so much for joining us.
Thank you.
Thank you. Take care.
You too. All right, well, still to come this morning, one local gym is giving student athletes in the capital area a big reality check.